So, have you ever stopped to think about how your body sends messages? It's fascinating. You've got this one chemical, acetylcholine, that can tell a muscle to snap into action instantly. But it can also tell your heart to gently slow down. How in the world does the body use the exact same messenger to give two totally opposite commands without getting its wires crossed? Well, that's what we're going to unpack today.
Right, so that's the big puzzle. How can one single chemical signal be a starter pistol in one place and a dimmer switch somewhere else? It seems impossible, right? But the answer is, well, it's just incredibly clever. It's one of the most elegant design principles in our entire nervous system. You see, the secret isn't actually in the messenger itself. Nope. It's all about the receiver that picks up the signal. Acetylcholine talks to two very different types of receptors. And honestly, the best way to get it is with a super simple analogy: a light switch and a smart thermostat. Okay, first up, let's talk about nicotinic receptors. Think of these as a simple, no-fuss light switch. You flip it and bam, the light is instantly on. There's no delay, no hesitation. It's a direct all-or-nothing command that says, go, right now. But then you've got the muscarinic receptors, and these are the body's smart thermostats. They don't just flick things on and off. They get the signal from acetylcholine and then kick off a much more complex, kind of slower process to fine-tune what's going on, gradually dialing the cell's activity up or down as needed. So we've got our mental model, right? The instantaneous switch versus the thoughtful thermostat. Now let's get under the hood a little and see the mechanics that make them work so differently. And this table really lays it all out. Just look at that first row, receptor type. Nicotinic receptors are ionotropic. That's a fancy way of saying the receptor is the channel. The signal arrives, a gate flies open, and the effect is immediate. We're talking milliseconds. That's our switch. But muscarinic receptors are metabotropic. They need a little helper, a G protein, to relay the message inside the cell. That extra step, it takes time. Seconds, not milliseconds. And that is our thermostat. So really, when you boil it all down, the crucial point is this fundamental trade-off. The body uses nicotinic receptors when it needs blindingly fast, simple, get-it-done-now signals. And it uses muscarinic receptors when it needs a slower, more measured, and nuanced response, one that can either crank things up or dial them down. All right, so now that we know the what and the why, let's look at the body's actual wiring diagram. Where do we find these switches and thermostats, and what are their very specific jobs? So nicotinic receptors are the perfect relay switches. In our autonomic nervous system, signals often have to jump from one nerve cell to the next. Think of it like a baton pass in a relay race. That handoff point is called a ganglion, and that's exactly where you find the nicotinic switch. Its only job is to pass that signal along as fast as humanly possible. No delays, no second guessing. Just go. Muscarinic receptors, on the other hand, they're at the finish line. They're on the target organs of our rest and digest system. This is where the command finally turns into an action. So when acetylcholine hits a muscarinic receptor on your heart, it acts like that thermostat turning down the heat. It slows your heart rate. But on your stomach, it turns the activity up to boost digestion. See? It's all about that careful, fine-tuned control. Now, this isn't just some cool bit of biology trivia. Understanding this distinction is absolutely critical in medicine because it means we can design drugs that target one type of receptor while completely leaving the other one alone. And this is where it gets super practical. Take a drug like curare. It blocks the nicotinic switch right where the nerve tells the muscle to move. The result? Paralysis, which is exactly why it's used as a muscle relaxant in surgery. Now, on the other side, you have a drug like atropine. It blocks the muscarinic thermostat. So if a patient's heart rate is dangerously slow, doctors can use atropine to block that slow down signal, letting the heart speed back up. Two totally different problems, solved by precisely targeting two different receivers for the exact same messenger. It's brilliant. And really, that's the beautiful simplicity of it all. Our bodies create this incredible complexity not by inventing thousands of different messengers, but by using a few key messengers that talk to a whole family of specialized receivers. One chemical, acetylcholine, can be a starter pistol or a dimmer switch. It all just depends on who's listening. So it kind of leaves you with a final thought, doesn't it? Your body is just packed with these elegant, ingenious solutions. What other simple yet incredibly powerful design principles are at work inside you right now, quietly running the most complex machine we know of? Makes you think.